Hello, and how are you? Welcome to another session on postnatal care for women living with FGM. My name is Winnie Barrow. This is a series that is supported by a movement which is made of the Girl Generation, ACAF, and the University of Nairobi. So, in this, we are trying to create awareness and sensitize the community in regards to ending female genital mutilation practices. So in this class, we're going to explain further how do we care for the mother who has gone through FGM and has successfully delivered her baby. In the previous class, we were able to explain how to care for mothers during the antenatal stages, how to care for them during labor and delivery, and here we're going to explain now post-delivery, what can we do and how do we better take care of the mother to have good outcomes. If you're new, please don't forget to subscribe, like our videos, and also share with your community. So by introduction, we are advised that women living with FGM should receive counseling as similar to those without FGM. Do not lose any opportunity to counsel against FGM and to be able to explain to the mother the possible complications and side effects that come with performing FGM. So in this regard, postnatal mothers have successfully given birth to their babies. They have gone through the stages of labor and they have come out safe, or in this way we can say the child is good and the mother is good. But now what can we do in these postnatal stages? So the postnatal care for mothers is that you need to remember in the postnatal period, there's an increased risk of postpartum hemorrhage, and this is blood loss due to the delivery process. And then there's the issue where the mother could develop injuries to the urethra, the bladder, and even the rectum. And this is relating to the case of force and pressure while pushing the baby. But then the mothers can also develop fistulas, where you can have rectovascular fistulas or vaginal vesicular fistulas. There's risk of urine retention as a result of injury to the urethra. There could be case of genital wound infection, which may lead to septicemias, but also the psychological problems or mental instabilities. And so we need to be careful or be holistic in the care of the mothers who have gone through FGM. So how do we handle this case? First thing is we need to put mechanisms in place that targets all the possible complications that may occur during delivery or after delivery. For example, it's good that after delivery you check the blood loss of the mother and estimate that this mother is safe. So with postpartum hemorrhage, there's the beginning part of it, that is proper monitoring of the labor until this mother has good progress, no excessive loss of blood, and the vitals or the circulatory assessment of the mother is stable. And this gives us assurance that there's no risk of postpartum hemorrhage. Or looking at the risk factors that lead to postpartum hemorrhage, e.g., the traumas, uterine retentions, or any risk that may lead to postpartum cases. And then there's assessment of the vaginal canal to ensure that there's no injuries that have been observed, be it, let's say, lacerations, tears, or extreme tears that could be third grade, or tears that are severe that could have perforated all the way to the urethra or to the bladder or to the rectum. But there's also the aspect of assessing for fistulas. And fistulas, these are openings that are connecting from one pathway to another. It could be connecting the vagina to the rectum, where we call the RVF, that is rectovaginal fistula. Or we can have the case where the vagina could be connecting all the way to the bladder. And this is where we talk about the vesicovaginal fistula, connecting the bladder and the vagina. So these are possible outcomes that can be there. So how do we prevent this? We can do that by ensuring that we employ the proper mechanism while conducting delivery in the second stage and while also monitoring the labors. In case where you discover prolonged labor, it's good to intervene early enough to avoid excessive force while the baby is descending, or to ensure that there's no excess pressure put on these organs. Then there's risk of urine retention, mainly due to extreme pain or severe pain that is experienced in these labor stages. Then check for any genital wound infections, and in some cases, we can do prophylactic interventions by ensuring the mother is free from further infections or to be free from infections during the management. Look at psychological problem. How is her mental status? You can do a mental assessment to rule out any form of mental instability or mental disturbance, and to ensure, for example, lack of fear, or to eliminate any form of anxiety. Answer her questions, explain her troubles or worries so that she can be calm, she can be stable enough to avoid further complications such as postpartum depression. But don't forget the baby. Just as we care for the mother, we need to care for the baby also. So you want to be sure that the labor process was smooth, or the labor process had a good outcome, that the baby is free from any complications such as asphyxia. So asphyxia is a complication where the child has difficulty in breathing, or has severe lack of oxygen, or has severe status where they have respiratory depression or respiratory difficulties. But in complicated cases, or in the most complicated status, is death, which can really occur very fast if the children are not properly assessed, either through APGAR scores or proper physical examination of the newborn. Can have cases where the child complicates and end up in death. Then check for any further birth injuries due to, sometimes could be a difficult delivery. So check that there is no birth injuries, assess the head, check that there are no head injuries, assess the other parts of the body, the trunks, the limbs, and ensure that there are no dislocations or there are no malalignment in this case. And check for brain injuries. Remember, for example, babies who go through prolonged labor, or children who go through obstructed labor, can actually be born with cases of severe brain injuries, which is not a good case. So we want to rule out all these possible complications or possible status that can come in case a child is not properly managed during the labor and delivery stages. So just to emphasize, don't forget that you're managing the mother, but also you're managing the baby. And there are two outcomes here. We're looking at the outcome of the mother and the outcome of the baby. But the end game is to prevent any form of complications occurring in the mother or occurring in the child. So in the postnatal care of the mother, it will use a similar model as per what you've done in the antenatal, the labor and delivery, but here you always want to check on the FGM status. If they were done type 1, type 2, or type 3, or type 4, and you want to see the impact this type of FGM had on them, be it mentally, physically, be it in terms of social engagement and so on. So you want to work with them holistically to promote stability, to ensure that the mother is able to view themselves in a different way, to build on their confidence, to build on their mental stability and status, and to ensure that they're stable enough to progress on after the delivery. So ask her again if she has experienced any form of related complications in her previous pregnancies, and if this is her first pregnancy, then you want to ensure that she progresses well even in the postnatal stage, with no complications, with no development of any deviations, that she may be able to adapt properly in her society. And so this brings us to the last part. So you'll see that the progress is like the same: establishing the FGM status, ruling out any complications, and ensuring that the mother progresses well in her postnatal stages without any form of mental instability, physical complications, or any known outcomes that are negative. So in this case, thank you again for staying with me to the end. Please remember to share, comment, give this video a like if it's really been able to enlighten you about FGM, and also subscribe and click on the bell so that we can notify you in case we post our next videos. Until then, bye bye.